our health response team at the quarantine facility is being extra cautious to prevent further health risks. Now moving on to updates on PUIs outside of the NCC temporary quarantine facility. And we report as of 12 noon today that there are now only 30 patients under investigation or PUIs admitted in various health facilities. A total of 585 patients have already been discharged. To date, 531 PUIs have tested negative for the 2019 novel coronavirus and 40 cases with pending test results. We are observing a steady decrease in the number of PUIs admitted in our health facilities, and DOH is bent on sustaining this downward trend. While there is a looming prospect of positive COVID-19 cases among our repatriated kababayans, we call on everyone to continue to be vigilant partners of DOH in keeping the threat of COVID-19 at bay. For the global situation, it has been reported by the DOH that as of February 27, there are a total of 85 confirmed COV or COVID-19 cases among overseas Filipinos or OFs around the globe. Japan recorded the most OFs with a total of 80, 70 admitted, 10 discharged, followed by UAE and Hong Kong with 2 cases each, and Singapore with 1 case. The most recent case was a 29-year-old Filipina who was admitted to a health facility in Hong Kong. The patient is currently in stable condition. COVID-19 continuously affects our kababayans overseas. The Philippine government remains at their service and would devotedly extend our assistance wherever they are in the world. The World Health Organization report that the COVID-19 has spread in 37 countries outside of China. This globally. WHO Director General Dr. Tedros Adhanom Ghebreyesus particularly noted that 9 countries, including the Philippines, reported no new cases of COVID-19 for more than 2 weeks. And while the DOH welcomes this positive development, particularly our repatriates in the New Clark City temporary quarantine facility. So I would like to conclude my press statement, and we are now open for questions from the floor.
Just a reminder to please limit your questions to those related to the COVID-19 health event, and also raise your hand first and wait to be acknowledged before asking your question. So let's start with the lady in maroon.
Secretary, good afternoon. Sec, is it possible to set up
Secretary, is it possible to set up a mini medical isolation facility inside New Clark City, since the exposure or the interaction of those who are suspected of COVID-19 cases may also give threat to those who are asymptomatic? Since although there are 5 chosen hospitals for the isolation, but is it possible to set up a mini or isolation medical facility inside New Clark City po?
There has been no recommendation to that effect, because remember when we set up our temporary quarantine facility, the Bureau of Quarantine officials had been the ones who helped in the setting up of the quarantine facility. So, mas mabilis kasi, diretso na. Meron na tayong ambulance, kesa you let them stay there in that small medical facility. Remember, the NCC has a polyclinic. But if we put them there, what for? When we can already bring them straight to the isolation rooms of our facilities.
And then, given that there is a possibility of pandemic, do we have enough medical workers to augment? Given na meron pong medical workers in different countries po. And then, paano po yung ratio ng medical workers to attend to patients under investigation?
The pandemic scenario is far off. Remember that the countries that have been affected by the COVID-19 are world. We have 195 countries. I don't think the threshold has been reached to say that a pandemic is nearly happening, because I don't think it should even be entertained at this point. Okay, so far what we can say is we have a decreasing PUIs, only 30, an increasing number of negatives, and hopefully that trend continues. So far, the way it is, our preparedness, readiness are adequate.
Last on my part po, on medical supplies, given the coordination with DTI, do we already have enough supplies po for masks?
Thus, we have the commitment by the DTI that the manufacturing company in Bataan Export Processing Zone has committed 200,000 masks a week for the DOH. So this is now being processed. 200,000 a week. 200,000.
Thank you, Secretary.
Hi, sir. Good afternoon. Yung repatriates lang po natin, in Japan, meron 10 na gumaling na. Ang update po ba ay 8 out of 10 ito ay nakabalik na ng Pilipinas? And ika-quarantine din po ba sila?
I am told that they are back in the Philippines, and since they have been tested negative following the Japan protocol, I believe that they need not be quarantined, but however, they have to be monitored closely by our local epidemiology surveillance officers.
Pero may advice po ba tayo dito sa 8 na ito na huwag muna silang humalubilo sa public, given that there are instances na worldwide merong report na resurgence ng disease?
The resurgence is not clear to me. That might be speculative, but it's not clear to us. The question perhaps is, once you were tested positive, and then you got well, and then tested negative, and therefore you were allowed or you were discharged, will there be a possibility that you will recontract the virus? Parang gano'n yata yung context ba? Pwede mo bang makuha ulit? Number one, the COVID-19 is a novel coronavirus. We still don't know much about it in terms of the antibodies that it stimulates to be produced by the individual. There are studies by and large about coronaviruses in general, not specifically COVID-19. So yung coronavirus in general, and if I recall the text message to me by RITM Executive Director Celia Carlos, para 8 to 16 months meron pa antibodies, after which it will start to wane. Yun lang yung information that I can tell you.
Lasa na naman ngayon. Yung mga Koreans natin sa Cebu, tama po ba yung procedure na ginagawa ng local DOH natin doon na sinesegregated lang sila sa mga hotel rooms nila? Or nakauwi na po ba itong mga Koreans? Anong update po natin po?
Yung sa Cebu, sir, ito po ay kino-ordinate ng regional office natin through with our local government units, and all of these travelers or foreigners were advised to stay in their hotels for quarantine. But some of them opted to just leave the country. But meron pa rin pong nandun na naka-quarantine pa rin dun sa mga hotels nila, and this is being monitored by our local government there in Cebu.
Ilan na po yung nakalista?
Wala pa kami exact information as to the number, but what we know of is initially there were 26 of these foreigners or Koreans who arrived in Cebu and went to 2 places in Cebu. So nahati yung 26 na yon into these 2 places in Cebu.
Hello po, sir. Sir, are you considering po na mag-impose po ng travel restrictions sa Japan? And the second question ko po, matutuloy po ba yung Philippine Mall sale po on Sunday? Thank you po.
Punta ka? Punta kayo? O tama, wala na tuloy sa isip yung unang tanong mo. Well, the Japan, any recommendation or proposal to include Japan for a possible selective or absolute ban is up for the task force to consider. Pending, of course, the submission by DOH of the risk assessment. Yung risk assessment that we do has 4 health aspects, about 4 criteria. Number 1, is there a local transmission in the country that is proposed to be included in the ban? Number 2, the volume of travelers. Is the volume more than 100,000? Because if it is more than 100,000, that's going to be presenting high risk. Sabi, kung maraming darating, no? Okay. Then number 3, I think is yung context, fragility, and threat environment based on the international health regulations. So, kailangan din itong isama doon sa criteria, tapos yung health expenditure per capita as PUI. No? So, if it is more than 50,000 pesos per capita, mataas yun. No? So, that is one of the criteria. And then, of course, the travel, yun na sinabi natin, volume of travelers, kung color-coded kasi. Kung green, less than 50,000. Kung moderate, yellow, 50,000 to 99,999 travelers. High is red, more than 100,000, as I have said. Okay. Tapos, entry restrictions of territory from individuals coming from China. So, yung mga countries, halimbawa Japan o South Korea, meron ba silang full restrictions to persons or travelers coming from China? Kasi kung wala, tataas yung risk natin. Follow? Nakikinig ba natin yun? Kung hindi sila nagre-restrict. In other words, kung tayo, di ba nag-travel ban tayo sa China? Eh yung iba, hindi nag-travel ban sa China. So pasukan din yung mga travelers and persons from China into those territories, into those countries. Eh, ang tanong dyan, nakakatakot siya tayo. Parang medyo may risk sa atin. Okay? So, meron full restrictions, green, limited restrictions, yellow, no restrictions, red. So, ito yung amin ulit ipapakita sa task force para objective yung atin basis for deciding as a task force which countries will be upon which we will impose ban, whether selective or total.
Saan yung mall?
Yung mall. Mahirap kasi, I was told by, ano ba ito, mall-wide sale?
Yes, po. Until March 31.
March 31.
1 month?
Yeah, our advisory remains, no? If it can be helped, we discourage people from going to places where there is quite a volume of people, just to make sure that no increased risks is going to confront our people. No? So we don't encourage it. Now, if it will be continued, we just, again, consistent with our advisory, the disinfection procedures must be followed. The availability of disinfectants must be there, provided by the mall management. And better still if the guards or whoever is designated to do a thermal gun on everyone who enters the mall. So yun ang mga conditions that will more or less reduce the risk.
Sir, just a clarification on the suspected, the PUIs in New Clark City, sir. You mentioned na meron pang dalawang bago. Can we clarify this? If they turn out to be positive, would this be considered a local transmission, or will the case still be considered foreign acquired?
Yeah, remember the origin or the derivation of the repatriates is the ship, the MV Diamond Princess Cruise, which was quarantined in the port of Yokohama. The ship was docked there. So I believe this has to be considered as an imported case. So it's not going to be categorized as a local transmission should there be any one of the tests that will yield positive.
Sir, currently we are in code blue, correct?
That's right.
Okay.
No
that's-
local transmission.
No local transmission. Can we just parang illustrate what code blue is and how different is it from code red? Because we understand pag code red pa, sir, tama, na pag nagpakita ka lang ng symptoms, you will be immediately considered as a PUI or a suspect case.
The difference between our code blue and code red would basically be first, kasi ang code blue natin, wala pa tayong local transmission, and when we have our local transmission, we'll definitely shift to code red. Now, with regards to response, for code blue, we just have heightened surveillance, and we do our tracing of contacts, and we do our guarding identification and of these cases, no, or tracing cases by across the ports that we have. But when we go to our code red, we already shift to this strategy whereby we do not really trace our contacts anymore, but we manage the cases already. So this would be very different because the capacity of our healthcare system, especially our facilities which provide services, should be heightened at this point because we already have shifted to this managing of cases.
Last question.
Dadagdagan ko lang, in the code blue, there are three essential measures, okay? Quarantine, which is what we are doing, okay? Whether you are a person under monitoring or patients under investigation, okay? Nangyayari na yan. Next would be contact tracing, tracing the whereabouts of people who might have been exposed, as we did for the first 3 Chinese nationals. And then, the case management, clinical case management of PUIs and testing of PUIs. So, kasama yan sa code blue, pati yung mga measures in code white, kasama din yan sa code blue. Pero yung code red, this is the one, meron ka ng epidemic surge, local transmission. So, yan na yung pati LGUs ay kasama na. yung kanilang barangay emergency health response systems are already activated. Okay? Right now, as we talk, inihahanda na rin po nila yan just in case. No? Na meron na silang, kasi the President and I met with the local chief executives 2 Mondays ago. And then it was very clear, we told them this is the list of deliverables and measures that the local government units ought to prepare. So, of course, the levels 2 and 3 hospitals of the LGUs must also be prepared.
Last question, sir. Can we get an update, sir? We understand that among the topics that were discussed in the IATF was the possibility of repatriation of Filipinos from Macau. Has the IATF decided on that?
Yes. Yesterday po, nag-meet po yung as instructed by our high-level interagency task force membership. Nag-meet yung technical working group ng interagency task force kung saan isa to sa agenda. So pinag-uusapan ngayon kung ilan talaga ang may intention at nagre-request coming from Macau ng mga kababayan natin para makauwi dito sa Pilipinas. Pinag-usapan din kahapon yung sa technical working group kung anong means of or what type of carrier, no? Kung sila ba ay sa barko o kung ito ay magiging eroplano para iuwi sila dito sa Pilipinas. Also, pinag-usapan din, of course, yung logistical requirements kapag sila ay umuwi at ano yung magiging proseso. So, everything has been para bang nabuo na and it will be recommended to our high-level officials for IATF meeting this coming week. And siguro pagkatapos nun, makakapagbigay na tayo ng decision.
Last 5 questions.
Kala ko last 50 questions. Alam ni DOH.
Sir, yung dun po sa tatlong repatriates na naunang dinala sa JV na, bakit po natatagalan yung resulta ng isa?
Well, the RITM has to be sure about the test results, okay? So, we leave it at that. I don't know the operational details, but I would like to believe that the RITM knows best what it is doing. So, baka naman lumabas mamaya. Hindi na.
Tapos yung dalawa po, kailan po sila dinala sa ospital? Yung dalawang nadagdag?
Kanina lang daw. Oh, kanina lang daw.
Tapos po dun, clarify ko lang sir, dun sa 10 na gumaling na sa Japan, lahat po ba sila nandito na?
8 lang na andito.
8 lang po. Tapos po,
Yung isa yata nagpunta ng Singapore. Yung isa,
Nandun pa sa Japan.
Sa Japan pa yung isa.
Okay.
The gentleman at
Ay,
the back,
last na po,
please.
sorry. Related lang po. Yung sa repatriation team po, wala naman pong nagpapakita ng sintomas sa NCC.
Andun ba rin sila sa NCC?
Wala naman pong symptoms, sir.
Wala naman. Oo. Of course, ito lang nga, yung una, yung sa Wuhan.
Hindi po, yung repatriation team po na, members ng repatriation
Wala
team
naman.
kasama.
Oo, wala naman. Mukhang they're all protected and adequately wearing their PPEs.
Gentleman at the back, please.
Hey, Sec, on this situation lang po of overseas Filipino workers in Korea, we've seen appeals from the OFWs na mag-provide daw po sana yung Philippine Embassy ng masks for them kasi yung presyo ay medyo tumataas na lang. Is this a matter that the IATF has been considered?
Well, we can raise it to the IATF, but again, our policy is if you're not sick, don't wear mask. Otherwise, you might contribute to the acute shortage of these PPEs, which should prioritize the healthcare workers, frontliners in provision of care to patients. So, wag na po. Dapat siguro yun ang maintindihan din nila.
Sir, also meron din daw pong mga gusto na daw pong magpa-repatriate from Korea. Are we considering this? And if so, saan po sila dadalhin? Because we have 500. Also with Macau din po, kung mag-repatriate from Macau and Korea, if and when, saan po sila dadalhin? Kasi we have 500 in NCC.
Our decision tool is such that if these OFs who wish to be repatriated are coming from countries such as Macau and now, of course, you were saying South Korea, select areas in South Korea, and they show no symptoms, they will undergo home quarantine. So they will just be persons under monitoring and in home quarantine. Please.
Right, last question, the gentleman in gray.
Magandang hapon po. Secretary, considering po na may mga PUI o PUM po na nakitaan po ng symptoms ng COVID sa NCC, may pagbabago po ba ng protocol o kaya guidelines po natin?
Wala. Ganun din naman yun. Dahil nung unang Wuhan na repatriates natin, nagkaroon tayo ng dalawa, nagkaroon ng diarrhea, nagkaroon ng fever, lahat dinala for testing. So, pretty much still the same. No change in our protocols and in our guidelines.
Lastly po, may mga PUI na ngayon pagka tinest, turned negative. Pero pagka nagkaroon ulit sa dinaan sa test, nag-positive, ano pong explanation po dito? May mga ganun po kasi mga cases na dinaan siya sa test, negative, but later on, nag-positive siya pagka dinaan ulit siya sa test. Ano pong paliwanag po dito?
Ang posibleng paliwanag dyan ay muna iugnay natin ito doon sa MV Diamond Princess Cruise. Nagkaroon kasi, tandaan ninyo, ang quarantine protocol doon sa barko. Mismo ang Japanese Ministry of Health, Labor, and Welfare nagsabi, nagkaroon ng lapse or lapses. Lumabas siya in the media. No less than their Minister of Health, Katsunobu Kato, said he was in fact apologetic that the breach in the quarantine protocols was inadvertently committed in that ship. So ano ibig sabihin nun? Una nilang kinuwarantine na mukhang effective, I don't know, I can't be sure, yung mga pasahero. Tapos sumunod yung crew. Yung crew naman, pinabayaan nila na makihalubilo because, you know, they needed to serve food down, they needed to clean, they needed to go around. So they were also being exposed. In that scenario, you have what is clearly understood as a sliding exposure. The exposure is sliding, the nature of exposure is sliding. In other words, hindi naman lahat sila na-expose at the same time. May na-expose on day 1, okay? May na-expose on day 2, may na-expose on day 3, 4, hanggang 14 days. Diba? Naandun sila. So, ang tawag na sliding exposure. So, pwede, sa una, negative, tapos eventually naging positive. Okay? Pagka naging positive, they become PUIs. PUIs, nadala na po yung 80 sa Japanese facilities, hospitals for appropriate care. Tapos naging negative na, yung iba, 10 naging negative na. O, sige, tama na ito. Okay.
Alright, last question from the lady.
Sec, ang follow-up lang po sa binigit nyo kanina na if ever po na pag-repatriate tayo from Macau and part of Korea, South Korea, hindi na po sila ika-quarantine sa NCC, home quarantine na lang. Bakit po?
Wala naman silang, unang-una, wala naman silang symptoms. Ang mangyayari niyan, siguro baka mas maganda na si Asek Merjari na lang sumunod.
Ma'am, yung lagi po natin pinapaliwanag, no? Ito pong kaso natin with our repatriates coming from MV Diamond Princess is a special situation. Kasi ang sabi nga po natin, ang pinanggalingan ng ating mga kababayan galing po sa barko na ito ay kakaiba po dun sa iba nating ginawa, like with Wuhan. Because yung transmission dynamics po nila doon sa barko ay kakaiba. It's a contained place, tapos po yung circumstances nila doon, hindi naman po natin masyadong alam. Pangatlo po, yung ang sinasabi kanina na secretary, yung sliding days of exposure ng ating mga kababayan doon. So, ang gobyerno din best na pagbalik nila dito, i-quarantine natin sa isang facility at para mabantayan natin sila ng gusto. As compared with these kababayans, if ever, if and when, we will be bringing them home from Macau, from South Korea, hindi po ganitong sitwasyon ang pinanggagalingan nila. Kaya po ngayon, pag dumating sila dito, kung sakasakali, we will just consider them as person under monitoring and then home-based quarantine, but this would be monitored strictly as well.
That ends our briefing for today. Thank you.